Hi, this is Paul Slatkus, Good News Broadcast. I'm speaking to Dr. Bruce Stambler. Hi, doctor. How are you?
Good morning.
Good morning to you, and we're speaking to Bud Ungar. Hi, Bud. How are you?
I'm very well, thank you. How are you?
Okay, good. The doctor's with Case Western University, and you're a cardiologist?
That's correct.
Cleveland, Ohio, and we're going to talk about, and Bud, are you a patient of the doctor's?
I am.
Okay, how is the doctor? He's a good guy?
I think he's the world's best doc.
Oh, is that right? Why? Well, how's he helping you? What's he doing with you?
That's an interesting question. He has put me on a new form of medication that has really developed a treatment plan to better manage my atrial fibrillation. And I'm a lot less anxious about going to the hospital. I have been hospitalized on various occasions, but since Dr. Stambler has designed this new treatment plan for me, I haven't had a hospital or a trip to the hospital within the past year.
Oh, okay. All right. Thank you, doctor, for helping Bud here.
Sure.
What is atrial fibrillation?
Well, atrial fibrillation, sometimes called AFib, is an electrical disorder of the heart. It involves the top chamber of the heart called the atria, whereby the electrical impulse in the top chamber is going at 300 to 600 beats per minute, very rapid.
Okay, and it's doing that that's irregular, right?
It's fast and irregular, correct.
Okay, and in essence, normally the rate should be?
Oh, anywhere from 50, 60 to 100 and 120 beats per minute is the normal heartbeat in both the top and bottom chamber. In the case of atrial fibrillation, the heart rate in the top chamber, the atrium, are extremely rapid, 300 to 600 times per minute.
Well, that's because Bud has a loving heart. He just wants to, get out there and make it work more.
Absolutely.
How does that happen? How does that happen for somebody?
Well, we don't exactly understand for sure the mechanism what causes atrial fibrillation. We do know that there are a number of risk factors associated conditions, the most important of which, unfortunately, is aging. As we get older, atrial fibrillation becomes much more common. About half the patients in the United States with atrial fibrillation are over age 65.
Okay. And the concern is?
Well, when the heart goes into atrial fibrillation, and again, that means that the heartbeat is very fast and irregular, the heart cannot pump blood effectively. And because of this, the consequence is, first of all, blood clots can form in the heart, and the blood clot could break off and, for example, cause a stroke. Other consequences is that patients don't feel well in atrial fibrillation. And finally, the heart doesn't function to its optimal performance.
So, in essence, I guess, with this kind of a knowledge, or getting back to what Bud said, a concern even to go to the hospital, because, you might have this, in essence, in your mind, back of your mind, some fear that because you have this condition, something might happen to you, right? So
exactly.
It's a question of how to adjust to the knowledge, even though I guess in life the day we were born we're starting on when's the question of when we pass, right?
Right.
But it's a question of now there is some physical ailment here. So how does somebody, first of all, how does somebody know they have it?
Well, sometimes patients have mild symptoms, sometimes patients have severe symptoms. It can be diagnosed relatively easily, relatively readily. If a patient, an individual, is in an episode of atrial fibrillation, they go see their doctor, go to the emergency room, it can be diagnosed via an electrocardiogram, an electrical signal taken from the heart, which is a very common test and easily performed, non-invasive.
Okay, and so somebody would be possibly, what would they be? Short of breath? What would then bring them to the doctor to get checked out?
Sure.
I mean, there are people walking around without the knowledge that that's what they have
yes,
at this moment?
Certainly. I mean, the symptoms can vary anywhere from, as you described, shortness of breath, palpitations, meaning the heart may be beating too fast or irregular, to severe symptoms such as passing out, losing consciousness. So the symptoms can be quite variable.
Bud, how did you learn that you had this concern?
I actually passed out. I had an episode at home, and they called 911 and took me into the hospital. And at that time, I was diagnosed with atrial fibrillation.
And so, in your daily life, well, when was this? When did you get diagnosed?
It's about 3-4 years ago.
And so the progression has it maintained itself? In other words, from the beat that you had 3 years ago, it's still the same at this point, or is there opportunities to improve upon it?
I've had tremendous improvement. In my case, I was fortunate that Dr. Stambler put me on a new medical course of action, and it's a treatment plan that he has devised and that has worked for me. And my life now is perfectly normal. I'm asymptomatic. I don't have any problems, whatever. But you can. I did have one case where I went back into AFib since I've been on this treatment plan, but I converted by myself. I mean, I did not have to be hospitalized, and I think that the plan that the doctor has put me on has made me so much less anxious about going to the hospital. It's not a pleasant experience.
Is the anxiousness, does that enhance the concern, the problem, AFib?
Certainly. If I can just clarify, some patients stay in atrial fibrillation all the time. Other patients, as is in Bud's case, can go in and out of atrial fibrillation. So sometimes they're in atrial fibrillation, other times they're in a normal rhythm. But the anxiety we talked about is not knowing when an episode of atrial fibrillation may start. It may be an inconvenient time. It may prevent people from wanting to travel or get around or do their activities for fear that atrial fibrillation may occur suddenly. And when patients come to see us, we make a diagnosis and develop a treatment plan that is individualized, that's customized, that's comprehensive, that takes into consideration their medical condition and the medications that they're on at that time.
Is this actually? I had a great experience. I did the Brain series for public television many years ago, about
Yes.
10 hours. Is this, of course, everything is brain related, but is this brain related?
It is brain related in the sense that the most feared complication of atrial fibrillation is forming a blood clot in the heart during an episode of atrial fibrillation, which can break off and cause a stroke. So that, in the sense, is the feared complication, and we always consider of vital importance is protecting the brain in patients with atrial fibrillation.
So back to the reasoning and how it occurs. Do you feel it's stress related?
Well, there are underlying conditions, and if one has an underlying condition, stress can certainly trigger an episode of atrial fibrillation in someone who has a predisposition, who has an underlying risk factor for atrial fibrillation.
Well, tell us about, with Bud, what kind of a program did you put him on once you realized that he had this?
Sure. So as I've already emphasized, every patient is different, and I work with my patients to develop an individualized treatment plan. In Bud's case, we decided that a medication that has come available in the last year, Multac, would be an important part of Bud's treatment plan. Bud has been on Multac for about 6 or 8 months now and has done well on it. But it's important to emphasize that Multac isn't for everyone. For example, certain patients with certain heart conditions, especially those with severe congestive heart failure, should not be receiving Multac because in those patients there is an increased risk of dying. But other patients may be appropriate for treatment with Multac if they have atrial fibrillation. And I encourage people to speak to their doctor.
And so what would something like that do? What would that Multac, what does it do?
Well, it's indicated in patients with a history of atrial fibrillation with additional risk factors to prevent the need to be hospitalized. It's a medication that is designed and indicated for controlling the heart rhythm in patients with atrial fibrillation. We know that patients with atrial fibrillation are very likely to need to go to the hospital, and it's been demonstrated that this medication, Multac, reduces the need to go to the hospital.
Well, what do they do when they get to the hospital? Why do they need to go to the hospital?
Well, they may be very symptomatic during an episode of atrial fibrillation, the kind of symptoms that in Bud's case caused him to pass out, which can be a serious consequence of atrial fibrillation. Other patients may have chest pain, shortness of breath, and go to their emergency room or go to their doctor and get evaluated, and we discover on an electrocardiogram that in fact they're in atrial fibrillation.
So in other words, this makes the heart steadier. It does not beat as fast. Is that what happens?
Correct. It doesn't beat as fast, and it controls the rhythm. It prevents the episodes of atrial fibrillation.
And so if you have that, let's say, this condition, wouldn't you sort of like take that for, in essence, your life? That kind of a help here? I mean, drugs are wonderful, and the drug companies spend a lot of time and money and a lot of great trials, and people are willing to, put their lives sometimes on the line to help to come up with solutions for things like this, right? So I think if there's a pill that can help somebody, it's a good thing. So, I mean, will he be on that for a while, in a good way?
Yeah, we expect in Bud's case that he'll be on this medication at this point indefinitely because he's doing well on the medication without problems or side effects. But it's important to emphasize, again, that this may not be for everyone, that
Sure.
the care has to be individualized, taking into account the overall treatment plan of the patient, the associated medical condition, and what's right for that individual patient, emphasizing the importance of safety and in prescribing medications.
And how did it occur? Like Bud said, it was like 6 years ago or something. I mean, he lived a kind of a life before that. All of a sudden, your heart starts to beat more as you get older.
Well, he was going, if I can just say, and then Bud can relate how he experienced it, he was having what we describe medically as paroxysms of atrial fibrillation, which means suddenly, without warning, he would have an episode of atrial fibrillation. His heart would beat very fast and irregularly. Other times, he would be doing well in his normal heart rhythm, but he wouldn't know when or if his heart would go out of rhythm into atrial fibrillation and experience these severe symptoms. And this precipitated and the need to go to the hospital for these episodes until we developed an effective treatment plan for Bud. And maybe Bud can talk about his own personal experience.
Yeah, Bud, how did this affect you?
Well, I think that the treatment plan that the doctor has prescribed for me has relieved the anxiety, because you become very, very anxious when you're not sure that your heart is going to function properly. I feel much better since I have been relieved of this anxiety of having to rush to the hospital and be converted. In other words, you have to be, the doctor can explain to you what I'm speaking of, but there's a cardioversion process which is done in the hospital. I think the doctor can explain that better than I.
Sure.
When you initially had this happen to you, though, Bud, was there anything, life-changing things going on with you at that moment? Was it a stressful period in your life?
Nothing at all. There was absolutely no warning, no reason.
Doctor, so, well, this is good news. You're helping Bud here, and
thank you.
And it's very positive, right?
Yeah, I think Bud is doing well at this point. I'm happy to say he's not needed to go to the hospital in the last year since we developed this treatment plan, and thank you very much.
Perfect. Okay, guys, thank you, and thank you, Bud, for coming out and having the world hear about your condition, because that'll help more people do better. So thank you both very much for sharing good news with us.
Thank you.
Thank you, Paul.
Take care. Bye-bye.